Helen woke up on Wednesday with sudden onset of a new dry cough and coughed consistently throughout the day for 48 hours. By the weekend, Helen had sore ribs from coughing so much, some wheezing and some shortness of breath, and visited their doctor. There was no fever. Based on Helen's symptoms and physical exam, the doctor diagnosed acute bronchitis. They discussed treatment options and whether antibiotics would be helpful. Acute bronchitis, often called a chest cold, is inflammation of the tubes that carry air to the lungs, the bronchial tubes. Inflammation is usually caused by viruses, typically the same viruses that cause colds and the flu. When these tubes are inflamed, they swell and produce mucus, a thickened fluid, which makes it harder for you to breathe. This makes you cough as well. Acute bronchitis usually develops rapidly and lasts about 2 to 3 weeks in otherwise healthy people, but can last up to 8 weeks. Older adults may experience more severe symptoms over a longer duration of time. These symptoms can include rapid breathing and even confusion. Older individuals may also be at higher risk for complications, such as pneumonia, an infection in the lungs or the lower tubes of the lungs. Most people can treat symptoms of acute bronchitis at home and don't need antibiotics or other prescription medicines. Antibiotics can have side effects, sometimes serious ones. Taking antibiotics also increases the potential for something called antibiotic resistance, which means that antibiotics may not work as well in the future for other types of germs. Of course, one of the other reasons is most bronchitis, acute bronchitis, is caused by viruses, and antibiotics don't work against viruses. They treat bacteria. We've asked Dr. Zain Chagla to talk about the use of antibiotics in treating acute bronchitis. Dr. Chagla is a doctor specializing in internal medicine, tropical medicine, and infectious diseases. He's a consultant physician at St. Joseph's Healthcare Hamilton and Hamilton Health Sciences, and an associate professor of medicine at McMaster University, also an adjunct faculty member at the University of Namibia in the Department of Medicine. Dr. Chagla's research and clinical interests include global health and tropical medicine, education and antimicrobial stewardship, infections in renal transplantation, and ultrasound in infectious diseases. Thanks for joining us today, Zain.
No, thanks for having me.
So why don't we start with what are the main signs and symptoms of acute bronchitis?
So acute bronchitis can mimic other syndromes. It's typically back and muscle aches, coughs, sometimes dry, but then progressing to a lot of sputum, chest pain, especially while coughing, chills, feeling achy, lousy, runny nose, sore throat, watery eyes, wheezing. In most people, it poses very little risk. It's a respiratory infection that typically resolves. Pneumonia, infection of the deeper airways is one of the more serious problems that can come from it. And again, it tends to be worse in people that have underlying diseases like COPD, asthma, cystic fibrosis, or heart failure. And really treatment for bronchitis depends on, the specific condition, underlying problems, and symptoms.
So it sounds like it might be as mild as a cold, but maybe a little more severe and could feel like a more serious lung infection, like a pneumonia in some cases.
Absolutely. And it is hard to tell the difference, especially in people that have chronic lung issues. And so again, it's always important if symptoms are progressive, if they're debilitating, to get assessed as part of this.
So let's say you're not feeling well and you do go to see your doctor. How is acute bronchitis typically diagnosed?
Yeah, so the most important part is that interaction with the physician. So going through a medical history, a history of symptoms, and a physical exam to really get a sense of when did this start, what are the symptoms, what other syndromes could be mimicking this. And then, other tests may be considered depending on the patient, a chest x-ray if there's underlying issues or a big suspicion of pneumonia, doing something called a blood gas to check gases in the blood, particularly for people who are quite sick in emergency settings or people who have underlying lung disease. People may have oxygen numbers measured through a pulse oximeter. And again, taking a look at oxygen in the blood, particularly in people that look more unwell or have underlying lung issues. If there is sputum or if there is nasal discharge, often that's sent for bacterial and viral testing. Some patients may also be referred for pulmonary function tests or spirometry, particularly ones with underlying lung issues like COPD or asthma. And these are used to see the flow of air in and out of the lungs in order to get a better sense if the disease is flaring up and they need more therapy to keep the disease under control.
One of the important distinctions here is between acute bronchitis and people who may have chronic bronchitis as part of a COPD or chronic obstructive pulmonary disease. And, if you're getting recurrent bouts of bronchitis, that's one of the things that one of the tests that a doctor may send you for is spirometry.
Absolutely. Again, that piece of chronic symptoms changing, becoming much more aggressive, becoming much more acute, but also, as you said, having recurrent episodes of bronchitis sometimes are an initial symptom of asthma or COPD, which again needs more long-term treatment for better control.
So a lot of people might show up and they feel like they've got a breathing issue and they're like, how come I'm not getting antibiotics? So I guess, how well do antibiotics work for acute bronchitis?
Yeah. So, again, the majority of bronchitis cases are still viral in nature. And we know antibiotics don't do a great job at treating viral infections. There's limited evidence, though, of the use of antibiotics, particularly in elderly individuals or people with several health conditions where there's a higher risk of bacterial infections. But, the widespread use of antibiotics also has issues. There's resistance, there's the cost of antibiotics, there's side effects. And again, if they're not going to offer much benefit, especially in a viral infection, they really need to be considered for the individual patient. Antibiotics might, in some studies, make the cough resolve a little bit sooner, might, in some studies, make symptoms resolve a little bit sooner. But again, these are predominantly patients that have a bacterial cause of this, and they have the risk of side effects, nausea, vomiting, headache, and rash. And the likelihood in when we look at large studies, particularly of bronchitis, up to 30 to 50% of the prescriptions of antibiotics in primary care are actually not needed for those patients and would likely get better with just time alone.
So bottom line, most causes of acute bronchitis are viruses. Antibiotics don't treat viruses. There's some evidence, it's pretty limited, that maybe you reduce the duration of the cough, maybe by something like half a day, but at what cost in terms of potential side effects? So vast majority of cases don't need antibiotics.
Absolutely. And again, time and that relationship with your doctor often are enough to support people through this disease. If they're, if they need antibiotics at a later time, it's often something that can be offered, but not necessarily for every single person walking into the office with those symptoms.
So I guess you mentioned a few of the potential cases, but why might your healthcare provider recommend an antibiotic?
So certainly, if you have risks for pneumonia, for example, if you have COPD, and we know there's a high risk of bacterial infections there, asthma, lung issues like cystic fibrosis or bronchiectasis, or heart failure, those are people at higher risk of pneumonia. They're people at higher risk of developing more serious symptoms from the bronchitis. And so antibiotics sometimes are warranted even in those conditions, although in some of those people, they can be managed without antibiotics. And I think, again, if people haven't got better after about 2 or 3 weeks, if their sputum is getting much more productive and they're bringing up much, much more in a couple of weeks, it often is a sign that maybe it started off as a viral infection, but there is a bacterial component. And then, yes, antibiotics can sometimes help with that. But you can see it's very narrow cases. It's based on suspicion and, again, patient risk. The vast majority of cases likely will resolve with time as the virus resolves with them.
If most cases will resolve over time and most cases don't need antibiotics, what are some of the things that people can do to help manage the symptoms?
Yeah, I mean, much of the advice is the same as we've been told for managing typical colds and coughs. So drink fluids, consider cough drops, avoid things that irritate your airways like cigarette smoke, get enough rest. And if you're having symptoms of muscle aches and fevers, consider taking drugs like Tylenol. Ibuprofen or aspirin are also reasonable, but you always want to have a conversation with your physician around whether or not they're safe, particularly if you have heart problems or kidney problems. And again, aspirin shouldn't be given to kids under the age of 18. Make sure to follow all instructions on the label for these medications, but they can sometimes help with just relieving some of the symptoms so people feel a bit better and letting their body do the rest of the work.
Is there a role for cough suppressants, or should we let people cough it out, kind of thing?
For the most part, I think cough suppressants are may not actually improve the disease. Again, our body wants to cough stuff out. It's a way of removing mucus out of our lungs and getting rid of it. It is one thing that you do want to chat with your physician about. If it's the cough is fairly debilitating, then sometimes they're prescribed. But again, for the average individual, it's important to just have the normal cough and moving sputum, as that actually is probably helping with clearing the infection more than anything else.
And I guess getting some rest. So if the cough is interfering with your sleep, maybe try some at night to ensure you're getting rest to recover from the illness.
Absolutely.
So we've talked about things you can do if you get acute bronchitis. Are there things that you can do to avoid getting acute bronchitis? Any preventative measures?
Yeah, absolutely. So, avoiding triggers for airway issues. So, cigarette smoke, particularly, or household smoke, dusts and inhalants. So if you're smoking, try to quit. If you work in a workplace with environmental dust, then consider wearing your mask. And really, again, avoiding those airway triggers. Common sense like hand hygiene, as we've learned about so much in the last 18 months. That they do prevent many viruses, including COVID-19, but respiratory viruses that we see during cold and flu season. Avoid contact with people who are sick and have the cold and flu. And similarly, if you have the cold and flu, make sure you're staying home until you're feeling better. And then finally, there are immunizations. So the influenza immunization taken every year, your pneumococcal vaccine, particularly those over the age of 65 or those with underlying health conditions, can consider taking it, and your COVID-19 vaccine, which again is another respiratory cause of acute bronchitis.
What if somebody's got acute bronchitis and, a week goes by and you're like, okay, I'm still coughing. Is that something where people would, say, okay, now an antibiotic is indicated, or let's say that, the sputum changes. Is that an indication for antibiotic?
Yeah, I mean, there are a lot of these things that we use sometimes in old practice to say it's a guide for antibiotic use. If the cough lasts longer, we should use antibiotics. Or if the sputum turns a bit more green or dark, that's an indication for antibiotics. The reality of the situation is, it's up to 3 weeks in half of patients, maybe over a quarter of patients that have a cough that's lasting a month. Even in that context, the use of antibiotics doesn't necessarily change those outcomes. And again, there is the expected piece of antibiotic resistance and side effects that may be induced by this. It's not unreasonable to see your clinician if it hasn't resolved in 14 days. But again, it's not necessarily a need for antibiotics. It's a need for an evaluation and a monitoring of symptoms. Similarly, the change in color of sputum used to be a diagnosing feature of bacterial versus viral infections. And the reality is, particularly in patients with underlying respiratory diseases, the change in the sputum likely does not really tell a great deal between whether or not it's viral and bacterial. So, bottom line, antibiotics are useful in very certain cases. Persistence of cough may or may not be a total use of antibiotics. And again, giving antibiotics early doesn't necessarily change the prognosis of the disease. Some people, unfortunately, will have a cough that lasts more than a month and again, needs just time more to resolve.
So patients rather than antibiotics, but get reassessed if you're not getting better or you're developing new symptoms, just to make sure it hasn't progressed to something like a pneumonia that might benefit from antibiotics. But just don't underestimate how long some of the symptoms might last.
Absolutely.
Well, thanks so much for joining us today, Zane, and take care.
No problem.